Family members and co-workers are grieving the COVID death of a Customs and Border Protection officer. As our ABC 10 News reporter Michael Chen tells us, the 65-year-old never contemplated retirement.
Genaro Guerrero's first symptoms were a runny nose and a fever.
Usual, flu-like symptoms, I believe.
Son-in-law Giovanni Tello says in mid-January, Guerrero tested positive for COVID, and days later he was admitted into the ER.
His oxygen levels were fairly low, and it was recommended that he go to the hospital via ambulance.
After weeks in the hospital, Guerrero was intubated earlier this month. Then, on February 15th, Guerrero, a father of 4 and 15-year veteran officer for Customs and Border Protection,
Very heartbreaking.
passed away at the age of 65.
Disbelief, and it's definitely surreal.
Tello calls Guerrero a generous, outgoing man.
He was lively. His personality, immediately filled the room with joy.
Who loved to hike and loved his job. Tello says Guerrero never thought about retiring even during the pandemic.
He's serving his community, serving his country, and he just loved the feeling of helping people out. And he was a great man for that.
Family members aren't sure how Guerrero contracted the virus, but they say he was diligent about masks and other precautions. COVID-19 continues to impact the U.S. Customs and Border Protection Agency. Across the country, more than 7,800 employees, including Border Patrol agents, have tested positive. 25 have died. Tello urging others to continue taking precautions.
It's devastating, and it's one of those things that, again, you don't want it to happen to anybody.
Michael Chen, ABC 10 News.
We reached out to Customs and Border Protection for a comment. We're waiting to hear back. A GoFundMe campaign has been set up to help with Guerrero's family with their expenses. There's also a link on our homepage at 10news.com.